Welcome to another episode of MedTalk. My name is Dr. Tushar Patel and I am your host. We have a distinguished physician guest, Dr. Robert G. Lahita, MD, PhD, also known as Dr. Bob, with us today. Dr. Lahita is a director of the Institute for Autoimmune and Rheumatic Disease at St. Joseph Health and author of the upcoming book, Immunity Strong. Dr. Lahita is our expert physician during this pandemic and has been providing his expertise and valuable information to our viewers since the pandemic began last year. Welcome back, Dr. Lahita, to MedTalk on our continued discussion on current state of pandemic.
Thank you, Dr. Patel. It's a pleasure to be here.
So, Dr. Lahita, after more than a year and a half into this pandemic, we are now at a very tricky stage with this pandemic as we are moving into colder winter months. Now with the Delta variant on rise in almost all the states in the USA, what can you tell? Where are we heading with this pandemic now?
Well, as you know, Dr. Patel, we have a new variant. We have a variant called the Omicron variant. And this originated, it is thought, in South Africa. And by the time everyone heard about it, and indeed President Biden heard about it, it was already present in the United States. We had no idea that this was the case, but we now know there are at least the presence of this variant in 26 countries on 5 continents. So it really was disseminated some weeks ago, which only became apparent last Friday, a week ago today.
Wow.
When I first reported on this variant. And I have to say that it's a very, and I mean, if I may just talk about the variant for a bit, it is a variant that has 26 mutations in the spike protein. Now, for your viewers, when the virus gets into you, what it does is it goes into your cells and creates a protein vis-a-vis the RNA from the virus. And that protein is called a spike protein, which is used to identify the fact that the virus is infecting you and also to provoke the immune system. And the immune system is provoked very, very well. And with the Delta variant, which was the one that's 99% of the cases in the country right now, the Delta variant has been very, very adaptable to vaccines and booster shots and all sorts of other mechanisms of protecting people. Those who are non-vaccinated that get the Delta variant suffer a great deal. First of all, it's very, very devastating. You can wind up in the hospital, in the intensive care unit, and indeed die from this on or off a ventilator from the Delta variant. With regard to the Omicron variant, this variant seems to so far be, in at least the vaccinated patients, it seems to have a much more milder disease, which is maybe falsely encouraging. It is more transmissible. And the fact that it's more transmissible doesn't mean that the disease that we get is going to be worse, but it just means that there are going to be a lot of people infected by this. And now all the genomic labs in the United States are looking for the Omicron variant. There are 5 cases now in New York State, none in New Jersey that I'm aware of, but certainly Hackensack Meridian CDI laboratory, the Discovery and Innovation Laboratories, are looking for the Omicron signature. And the way they do that is when you get infected, you get the nose swab and a polymerase chain reaction, or PCR, is done. And they look for various RNA signatures in the sample of virus that they extract from your nose. And so far, we haven't found any in New Jersey, but I think it's only a matter of time. So that's where we are on the pandemic. We're worried about a 4th or 5th wave because of the holidays, Thanksgiving and now Christmas. And also that people gather, at least in the Northeast and in some parts of the country, in homes to stay warm. And in those homes, there may not always be a vaccinated person. If everyone is vaccinated and gets their booster shots, we're good. But this variant probably developed in somebody who was infected and harbored the virus for many months. And the virus then gets a chance to mutate in such an individual.
So let me ask a question regarding the Delta variant on rise and the new variant Omicron on horizon right now. What is our biggest challenge, biggest concern at this time in the US as far as this pandemic goes?
the biggest challenge is getting people vaccinated. For the wealthiest country that we are, we have the lowest number of vaccinated individuals. 59% of the population is currently vaccinated, which means that 41% of the people of the country are not vaccinated. And that's unbelievable to me as a doctor and as a scientist. I would think that people would go and get the shot. It's very easy. People are worried. I mean, stories come out about all sorts of things. You don't even want to hear them, but anything you can imagine in your head has been told to me about why I should not get the vaccine. And that's really a lot of baloney. The vaccine is very, very safe. And even if you do get slightly ill from the vaccine, it certainly means that your immune system is working and it is there to protect you and setting you up so that you don't get severe infection, severe disease, and wind up in the intensive care unit.
So do we have any data, Dr. Lahita, regarding the Omicron affecting the vaccination people? Do we have anything available right now?
Nothing available right now, Dr. Patel. As soon as information comes, I get it. But we have nothing because we have so few cases right now in the U.S. At least from South Africa, Dr. Kotze, who's the head of the South African Medical Association, says that those patients who've been infected with the Omicron variant are not very ill at all. And the second thing is that a lot of children below the age of 5 are apparently affected by this variant, which in itself is a bit alarming, but the extent of disease, as you know, in children is not significant, at least with the Delta variant either.
So let's talk about the vaccine hesitancy and lower number of vaccine people are receiving in some states where we have problem right now. What is your message for those individuals? There are so much misinformation and rumors about the safety of the vaccine. Already mentioned by you before many times that the vaccine is very safe. What is your message for our audience?
Well, the reason the variants come about is because people are non-vaccinated. And in South Africa, the extent of vaccination is less than 30%, I believe, I'm told.
Yes.
It may be higher than that. But at any rate, the vaccination rate in many other countries, such as in Africa and the Far East, is much lower than in the wealthier countries. And in fact, our country, the US, is probably the lowest vaccination rate of any wealthy country on the planet, which is very bad and sad. I realize that people have concerns, but again, the only people who are dying in the hospital are the ones who are unvaccinated. The patients who are getting sick can be vaccinated or unvaccinated. Now, breakthrough infections are not rare, but they don't kill you. And actually, the breakthrough infections may well represent many variants that infect the population. There's just subgroups of virus. I have a map here with all of the different spike protein alterations that one can see with this virus. And this virus, until we have a large amount or large number of the population immunized, is going to continue to upregulate with mutants. Mutations are not a good thing.
Yes, yes. So I usually don't like politics in our talk, but I just wanted to ask you one question. Is the federal government taking appropriate steps right now to provide education, provide resources to the people who did not get the vaccine, getting more vaccination, getting more testing widely available, easily available, all those kind of things?
Yes. Well, the federal government has stated very clearly that they've got rules for departure to various countries. And the rule now is within the day of departure, regardless of your vaccination status, you must be immunized and you must be tested for the virus. And that goes for US citizens and foreign nationals. The second thing is that masks are going to be mandated through March rather than in January.
January, yes.
You get a $500 fine or a $3,000 fine if the offense is a second offense of not wearing a mask appropriately in closed spaces. And thirdly, they're going to expand home testing, which will be for free, and expand the booster shots, which should be given to virtually everybody over the age of 18. And it's possible, as I reported this morning on CBS News, it's possible that Pfizer-BioNTech, I know the leader of BioNTech Laboratories is talking about in 100 days having a vaccine for the new Omicron variant. They're working on that now. You see, with molecular medicine, it's extremely easy to create a vaccine almost immediately. And that's why people are afraid. They're saying, oh, this is too soon. This vaccine hadn't had 10 years of experience. Well, you know, with molecular medicine and the advances in science, we don't need 10 years, to develop a vaccine. We need about 2 weeks. And that's really remarkable science. So in 100 days, there will be an Omicron variant of the Pfizer-BioNTech vaccine and probably many others. As I said, overseas now, how to attack this problem. The government is saying that we're never going to get ahead of ourselves unless we eliminate the virus in countries that are poor and countries that don't have appropriate facilities like medical care, hospitals with intensive care units, and epidemiologists, etc. So 200 million doses in the next 100 days are leaving this country for Africa, for example. 1.2 billion with a B doses are going globally. And this is beginning from South Africa and working through Africa and other parts of the Middle East. It's very, very important that we start to immunize those who cannot afford it and those who do not have access to the shots. Remember, to have the shot, especially the shots like Moderna and Pfizer, you have to have freezers, you have to have the facility. Yes. So that's not possible in the middle of Lesotho, where, you know, it may be 95 degrees and you're talking about an outpost. By the same token, those countries, if you go to those countries, you better plan that if you should get sick, that you know where the nearest large medical center is, or prepare to have yourself evacuated from those countries.
So rapid scale up of the vaccination is the key factor in fighting this pandemic. Is that correct, Dr. Lahita?
That's correct, yes.
And let me ask you one other question regarding the Omicron variant. What is your predictions for the US in next 2 to 3 months? Do you think we will have shutdown? We will have a modified way of doing our normal activities? What is your predictions?
My prediction is that there will be spikes, but it will be nothing like what we saw in 2020 or early 2021. I don't believe in shutdowns. I think it's bad for the economy. Yes. It certainly is bad for our school systems, college and secondary school and elementary school. Children don't get infected that badly. And it looks like right now with the Omicron that the adults are not adversely affected. I think anybody who's at risk has already been immunized. Nice. Nursing home patients, patients who are extremely obese, those who have lung, heart, and other conditions have already gotten their booster shots. We have over, I think it's 20 million people who have received booster shots in this country. And many, as I said, 59% of 350 million people in the country have been immunized and have completely been immunized. So I'm very encouraged by those numbers. However, there's still 41% of the population. So 40%, let's say round it off, of 350 million people, which is a lot of people. It's 100 and some odd million people who are not vaccinated. And they are fodder for propagation of this. Now, since the Omicron variant came out last Friday, over 2 million people additionally have been vaccinated, which is encouraging. Yes. And several million have gotten booster shots since they heard about this new variant. So I don't want to scare people, but I think we should educate people on the safety of the vaccines. Really, really important.
What is your message for those individuals who are still waiting to get the booster shot?
Well, I'm not so concerned about them as I am on those that are not vaccinated. Okay. The booster shot's going to give you a boost, but it's not going to totally mitigate the infection like a regular vaccination. So the first 2 shots or the first J&J shot, very important and very protective.
Very good. What steps can we take to stay safe and save lives between now and end of winter or early next year? When do you expect changes in our routine life from the current pandemic to new normal in the upcoming months? What do you see?
Well, that's a good question. I think by the spring, we should get past any surges that we see. We're worried about a fourth and a fifth surge of the virus. And so by the warmer months of April and May, we should be out of the woods with regard to clumping together. The holidays are the biggest concern because people are going into warm spaces. And if it's a large group of people at a Christmas party, for example, and maybe 5 of those people are not vaccinated, and maybe 10 of those people are infected, we could see some really interesting data come forward. It may be that we will have surges or super spreaders in certain areas, and that we don't want to see. But I encourage everyone that's watching this film to make sure that they and their family members, of course, children below the age of 5 can't get vaccinated, but everybody above the age of 5, and certainly 18 above for adults, should be vaccinated. And wear masks, by the way. If you're at a Christmas party, or as I saw, and I mentioned this this morning, at the lighting of the Christmas tree last night in Rockefeller Center, there must have been 10,000 people, and they were shoulder to shoulder, and very few of them had masks on. Now, that's outdoors, so it's not as bad as being in a ballroom or a theater, or being in an athletic stadium where you're indoors. That's not bad. If you're at a Christmas party with 30 people, better make sure everybody's vaccinated, or don't go. Or wear a mask and be very careful. Wash your hands and keep your distance if you can.
Very good advice. Dr. Lahita, you are one of the most reputed physicians in the country, and so far all your predictions are based on the science and epidemiology and very much on target. We appreciate that. I want you to ask one last message, a take-home message for our viewers.
One last message is, if we lack in vaccination, we're going to have more variants. Hopefully the Omicron is not a very deadly variant like the Delta virus. Now, we've had Mu and we had Lambda from South America. I think I talked to you about that on our last film, and that turned out to be nothing. So I'm hoping the Omicron is nothing. I'm hoping that we get back to normal by spring. I'm hoping that the president who said our mask mandate goes to March and hopefully not beyond March, that we will be safe and have a wonderful summer and be able to travel like we used to in the past.
Wonderful. Amen to that. Lastly, tell us about your new book, Dr. Lahita, which is coming out on January 5th, called Immunity Strong. And where can people find it? Where can people buy it from?
Oh, people can buy it everywhere. It's one of Costco's 2 books of the year. So it'll be in all Costco stores around the country. It'll be in Barnes & Noble. And certainly it's with Amazon. You can actually pre-order it on Amazon right now. Like my staff has been ordering copies, and they tell me if you order 2, you get 1 free.
Wow.
So that's pretty good. But it's a book that everyone should read to understand my voice as Dr. Bob, telling you how the immune system works, how vaccines work, how they're safe, what are the infectious agents that we have, not just COVID, but all sorts of things like malaria and parasites, etc., and a little bit of insight into the mind, body, and soul of the immune system. The immune system, I'll leave your viewers with this, is the biological soul. And it is, we have a spiritual soul, which many of us nurture, but we have also a biological soul, which wants to keep us alive for many, many years, well beyond 100 years of age. And I think if we nurture our biological soul or our immune system, we'll be fine. It's there to protect us, and it's getting a real run for its money these days with the coronavirus. And that's what I recommend. I recommend you all buy the book, and you'll have a wonderful read, thinking with my brain.
Congratulations in advance, Dr. Lahita, for that wonderful launch coming up in January. Thank you, Dr. Lahita, for your time and providing your expertise to IndusTV viewers, and appreciate your dedicated service to medical communities in tri-state and providing education via interviews and seminars during this pandemic. I would like to say happy holidays to you. Stay blessed, and thank you so much again.
And happy holidays to you and to your viewers, and may you all stay very healthy.
Thank you so much, Dr. Lahita.